pleural effusion or the fluid around your lungs gives you a lot of information about your health. Some amount of pleural fluid, that means around 5 to 10 ml, is a natural amount of fluid everybody has. You can't see that. But the moment a doctor picks up an X-ray and they see some possible fluid in your lungs, that means at least you have around 200 ml of fluid in your lungs. And if it is significant, you might be even having a liter of a fluid in your lungs. So whenever you are asked for tapping, that means the doctor will ask you for a fluid removal. They will put in a needle under the guidance of an ultrasound and they will take a sample of your fluid. This fluid will be of different colors and every color gives you a different story. For example, the fluid is straw color, that means light yellow color. There is a possibility of some infection, most commonly tuberculosis. In case the fluid is very high colored or pus-like, it could be an infected fluid happening as a result of a pneumonia. This fluid could be milky, which we call as a chylous effusion, and sometimes this fluid, when it is lying for a very long time, it becomes turbid. The fluid, when they tap, it could just be like mustard oil. This is called oily effusion. Very high likely it is going in favor of a problem called malignancy, that means lung cancer. Lung cancer also leads to bloody effusion, that means the fluid looks like blood, or red colored fluid. The red colored fluid can also be as a result of trauma. If you got some injury around your lung, you can have effusion, that is hemothorax. Different sort of fluids gives your doctor a different clue, but finally the right diagnosis is through the sampling. Then the doctor decides whether they need to drain the fluid through putting a small catheter, or they might even put in a drain by putting a chest drain called intercostal tube. This is the drain which is supposed to drain the entire fluid and then test it simultaneously to start your appropriate treatment. This is how pleural effusion is treated. So if you are told by your doctor that you have fluid around your lungs, do not panic. You could be suffering from one of the problems which I have discussed before, or sometime it could just be a congested fluid. That means the fluid which is stemming out of congestion secondary to your heart problem, liver problem, or kidney fluid overload. These fluids just need decongestion and nothing else. That's how be aware of what you're having and talk to your doctor on a free account so that the doctor and the patient are on the same page and understanding of how the fluid is going to be treated. I'm sharing a picture of different fluid colors and how fluid color gives you an indication of what problem you could be suffering from.